Coming up next is a session on putting AI in IVF. Is it a help or a hurt? Over 500,000 IVF babies are born every year, and though significant growth is anticipated of the segment. The process of IVF is seen as a roller coaster ride for expectant parents, as IVF cycles have only 30% success rate and each cycle being expensive. It's taxing financially, physically and mentally patients. In order to increase the chance of success, minimize complications, IVF experts are turning to artificial intelligence as they believe that the tool can provide expert clinical decision making. In this session, IVF experts will ponder upon how AI can improve success, reduce errors and lead to faster, cheaper and more accessible results.
Welcome one and all to yet another important session on ET Health World Fertility Conclave. It's the fifth panel for the day and we are talking about technology here. The topic to be discussed would be putting artificial intelligence in IVF. Is it a help or a hurt? We have a very eminent panel before us to discuss about this important and pertinent topic. We have Dr. Sunita Tandulwadkar, HOD and Chief IVF and Endoscopy Center, Ruby Hall Clinic. Welcome, ma'am. We have Dr. Asha Bakshi, Gynaecologist and Infertility Expert, Motherhood Hospitals. We have Mr. Nitish Murdia, Director and Co-Founder, Indra IVF. We have Dr. Nikita Lad, Chief Infertility Specialist, Apollo Fertility, Mumbai. We have Dr. Keshav Malhotra, Director, Rainbow IVF. Welcome all. And we have Dr. Jaydeep Tank, Obstetrician and Gynaecologist, IVF Consultant, Ashwini Maternity and Surgical Hospital, who will be the moderator and who will be taking us through this important topic. Thanks a lot, Dr. Jaydeep, for helping up not just with the moderation, for other things which I had requested you throughout the conference. Thanks a lot. Over to you, Dr. Jaydeep.
Thank you very much. Let me first begin by thanking the team for putting this whole thing together. ET Health World Fertility Conclave. It sounds very exciting, and I'm looking forward to seeing the entire program come to fruition. I'm delighted to have such an eminent panel with me today. Thank you very much, everybody, for agreeing to participate. It's rather unfortunate in a way that when we talk about artificial intelligence, the first impression is not of something which will help but hurt. I probably blame it on movies like The Terminator, where a robot comes from the future after destroying entire mankind, and then it literally salvages mankind in the second part of the movie franchise. In the first part, he's actually out to make sure that we all die. And unfortunately, artificial intelligence has always been looked upon as something which is going to take over our intelligence. And we sometimes tend to forget that artificial intelligence at the end of the day is what we make of it. And therefore, if you don't program something, maybe this is not true now with the artificial neural networks, but it still remains that till machines don't achieve what is known as singularity. And I thought the Matrix movie was a fine example of what happens when a machine achieves singularity. AI, I believe, is something which will probably be of great help to us in the future. The panel is actually titled, AI, is it a help or a hurt? And what I want to do is get the suspense out of the way and then try and prove the point of whether it is a help and hurt. So let me start with Sunita and ask you very, very briefly, maybe in a word or two, is AI in IVF a help or a hurt? Sunita first.
Jaydeep, I will say both. Actually, what happens, those of us who are doing for near 2 decades plus the IVF, we have the experienced embryologist with us. Our own knowledge, because of our own experience, has gone huge. And that's why we feel, what is our experience, our embryologist, we are absolutely great with it. But think of the next generation who will be coming up, whether they will have, because the way IVF centers are mushrooming, whether there will be so many, when we started, we went in a depth about each and every small part of the ART, may it be a clinician aspect, may it be the embryologist aspect. So for us today, I don't feel it will be. We have an embryoscope at GPU. How much we are using it, how much it is needing it. Only because it is a university recognized, it's free to the patient, I can afford to do. Will it be possible in my corporate institute at Ruby Hall? No. It will not be possible unless, you have that much of funds which you don't want to reimburse from the patients. This is not. But there is a new generation who's coming up who probably may not have so much of an experienced embryologist and their own experience. In India, who should start has no rule. What should be done, the law has been passed. But any gynecologist without any sound knowledge can start the IVF. Now, if they have a money and if they want to have an embryoscope with the artificial intelligence guiding, which obviously will be 1 lakh or 10 lakh patients' experience of someone else they are selling, and they can afford to sell this service to the patient, maybe they will be in a better position to give the success rate to their patients. 15 days course of a Foxy and they have opened up the ART centers. How you control them? The patients are paying from their pocket and it's very important for them. And probably they are the millionaires who can afford to buy this. So if they can give it free of cost to the patient, it may be little bit help, but otherwise, I don't think today what the technology, artificial intelligence is giving only with the embryoscope, I myself will be. If your artificial intelligence is giving pathology-related clinician help rather than just the embryologist help, then it may be a boon, which is not available as of now today.
Sure. I think, thank you, Sunita. You brought out an important point that the perspective of how you look at artificial intelligence is perhaps important. And another important thing you said, perhaps, which is at least very important presently, is the fact that artificial intelligence need not be there everywhere, but it could certainly be helpful for someone who's trying to fill the gap between basic knowledge and experience. And I think that's really where that artificial intelligence piece could help in bridging that gap, if I may say so, between your very basic knowledge at the beginning and the years of experience that go into making an excellent IVF clinic. We all know, and I'm going to move on with our panelists now, that Sunita has actually given a diplomatic answer, a very detailed but still a diplomatic answer, because she's not said whether AI is a hurt or a help. She said both. Asha, what do you think?
I think technology is always welcome. So if we can use artificial intelligence in an intelligent way, then yes, I think it is going to help. And especially everyone is fighting to improve the success rate of ART. I think that is where, if you can even improve the success rate, say by 5%, 10%, I think that is welcome. So, and that way, though it is going to come at a cost. It is not going to be, to say cheap. But then the time to pregnancy may reduce. So indirectly, it may overcome that. So that may be a thing. So I think we have to take everything with pinch of salt. We can't say that it is going to be expensive. In the long run, we'll see how the things go. Initially, yes, there will be hurdles. When computers came, we thought that, that means now mankind will be out of this thing and there would be no jobs and everything. And now see, we all are doing very well and progressing day by day with the help of technology. So we have to welcome this technology and use it wisely. And I'm sure somewhere there will be a good use of it. Only which is that who feeds the data, what sort of data are fed in, what sort of programming is done, and what transparency and honesty is there in feeding that data. If that all is good and we can get a good result, then I think it would be a boon for the field of infertility.
Sure. So it's going to be a help, but with some conditions.
Yes,
That's
definitely.
essentially what you're saying. Nitish, what about you? What is your view? Let's bring in an embryologist point of view before I ask Nikita and then Keshav.
For me, I think AI has been developed to a certain extent, but there is a lot of work still left to be done. So I think the way complexities are increasing in the lab, and the way the number of parameters or the biomarkers that we are dealing with, in the current time, and with introduction of more and more people going for the IVF treatment and the complexities of infertility increasing and the demand of this treatment going high across the world, and with new people coming in, I think experience is something which takes time.
Yes.
And this is something that we can't really, with the presence of this artificial intelligence and the data, if we can somehow put all this into a machine which can reduce the time it takes for a particular individual to gain that experience level, I think it's going to change the world. It's going to change the treatment to the patient, because as we have seen in the cancer also, that artificial intelligence is beautifully playing a role in terms of deciding the treatment protocols for the patient. In IVF field, because it started late, I think there is a lot of work still that needs to be done, but it is going to transform the way we deal and we treat the patient in future.
Sure. Thank you. So definitely a help.
Yes.
I think that's what you're saying. Nikita, what about you?
I think in this generation, I think we should partnership with the man and the machine. I think that's going to be really good for us. Let's all of us, think of the machine is going to help us even a bit, even one patient for me, it helps one result, up. I'm going to be happy if the AI is going to help me out. See, we can never replace an embryologist. That is one thing,
That's good news.
The embryologist is going to be getting the support by saying, yes, these are the embryos and this is the result. And I think, everybody, like Dr. Asha said, I think a lot of data, everybody, like we in PAN, India, Apollo clinics, we have a software wherein we put in everybody's, the data, like the age, the BMI, what injections did I give, what was the egg quality, the sperm, the reason of infertility, and the embryo. So, it did help my embryologist in selecting, and even us, which injection gave us the better result. So I think, yes, I would be with AI, but of course, not completely. We cannot leave our, skills the doctors need to have. Like we all know how to do per-vaginal examination and say 8 weeks pregnancy. Ask the new students, they will say, do a sonogram. I cannot say.
Sure. Well, that's also a form of artificial intelligence. Keshav, what about you? Help or hurt?
So I always think of artificial intelligence not as AI but IA, which is intelligence amplification. And I think this has the potential to completely revolutionize the way in which we practice medicine, not just IVF. Nitish has already told it's helping a lot in cancer, but because there are so many parameters now, it's not just the embryology lab that we're concerned about. We're also concerned about like patient history and all the different parameters that are associated. And now, as a human, as a doctor, we only have limited time. When you have something which can help us in pinpointing, okay, this might be the criteria, this might be the possible way to go about it, is just improving on the outcomes that you would have later on. I think it has a lot of potential, and I'm really looking forward towards it.
Absolutely. I think we are all in agreement here in a way, saying that fulfilling certain conditions is probably the prelude to artificial intelligence being a massive help. The conditions may be different. They may range from the kind of data that's available. They may range on the kind of applications that are available. And in fact, they may also include the kind of machines that are available. Because at the end, technology is really about the convergence, if I may say so, of information and communication. And as far as AI and infertility goes, the communication is the data. we are communicating with the machine, and perhaps we need to start looking at this whole thing as not something of a man versus, I'm sorry, I use the term man, it should be man or woman versus the machine, but something which says woman or man with the machine. Rather than versus the machine. I'm going to actually do this panel in 3 tranches. We'll first talk about how it will help in terms of HCP facing, that's healthcare provider facing. We'll then talk a little bit about how AI will help in IVF community facing terms. And lastly, talk a little bit about how AI will help with the research and business of healthcare. So now let's start getting a little into the depth of the whole thing and understanding why each of the panelists said whether it would be a help or a hurt with certain conditions. And Keshav, I'm going to turn to you here as perhaps the junior most of the group. Everybody's been saying that the juniors are the one who are more comfortable with technology. And Keshav, I'm going to ask you, machine learning and natural language processing are 2 terms that we hear quite often. Machine learning essentially analyzes structured data. I think Keshav lost the signal. He'll probably join back. But in a sense, machine learning techniques analyze structured data, and natural language processing extracts information from unstructured data. It is my feeling that at least currently, what we are looking at in AI in IVF is all machine learning. We really haven't moved to the next phase of natural language processing, which is actually a very exciting phase, because in the NLP process, you give it unstructured data, the machine learns on its own through artificial neural networks, etc., and then gives you a machine learning experience. Extraordinarily exciting, if you ask me. Let me move on then to the next part of the panel discussion, which is HCP facing use of AI. And when I say HCP, I'm talking about healthcare workers in general. Welcome back, Keshav. Let me ask all the panelists again. General internet use in your life, not necessarily your practice. How much is it for work and how much is it for non-work related activities?
70-30, I would say.
70-30. Nikita?
I would say 40 for work and 60 for non-work.
Keshav?
I'm with Nikita on this.
Yeah.
Even though I do a lot of work related like on the internet, but it's still 40-60 because I mean
40-60.
You can't trump Netflix 100%.
I think that's a major time eater, isn't it? In fact, I recently read a study which said that millennials would rather give up one of their senses, like a sense of smell or the sense of touch, rather than getting a loss of bandwidth or network. So let me then ask you, when you say that you use the internet the large majority of time for work, I think we typically will use the internet for networking or connecting to patients. And I would even go so far to the extent of saying that even WhatsApp is a form of AI, because there is a lot of artificial intelligence happening in the background. We use it for patient communication, peer-to-peer networking. We use electronic medical records, and we use it for retrieving information. I'm going to focus a little bit more on retrieving information, but from networking, patient communication, peer-to-peer network, and EHR, electronic health record. What would you think is actually the most important application of AI to you? And I must say here that it's a mistake to think that AI is only a robot working in the background or a robot working in embryoscope. AI has actually permeated all parts of our life, to the extent that when you log in to your Zoom meeting and it asks you whether to allow Zoom to start or not, that also is actually a form of artificial intelligence. When you enter a password to access a Zoom meeting, the Zoom server recognizes that you entered the password. Even that, according to me, is a form of artificial. So we need to look at AI much beyond what traditionally we have thought of as AI. So Asha, networking, patient communication, peer-to-peer network, or electronic health record, what is your what do you think you use most in terms of AI?
So as you said, WhatsApp, yes, of course, networking with colleagues and friends and relatives, yes. Otherwise, in day-to-day, whenever we have to make all these talks, and also we have to check for the guidelines and check for the newer things that are coming up and all those. So I think for that, we need to be on the internet for quite a long time. Then another thing is day-to-day, when we are talking to the patient, and many times you tend to forget about the medicines, the doses and all. And I very frequently, whenever I give something and then I feel that I should recheck. So for prescribing the medications and all, I use it quite a lot. And sometimes checking the side effects and all those. So in day-to-day practice, I think these days we can't do without all these things. We are so addicted to our, at least smartphone should be there. Maybe the laptop is not there, but the smartphone has to be there. Without that, I think it's very difficult. Even while telling the bedtime stories to the children, I tend to forget what it was and what was that rhyme like. And there also, I have to use internet. So in the night, every night, I think for half an hour to 1 hour, I have to be on the internet doing all those things with children. So
but that is not work related, Asha. वो आपके 20% में से वो चले जाता है.
So 20% उधर आता है.
Right. Thank you. So I think you have brought such an important point. We all keep on thinking AI is in the future, but the fact is that AI is already here, and it's permeated almost all aspects of our life, including medical practice and IVF. Nitish, I'm going to ask you, as someone who runs a very large chain of clinics, from what I had said earlier, networking, connecting to patients, communication with patients, peer-to-peer networking, I'm sure is very important for you and EHR. What do you think is where you'll probably see the next big breakthrough from these four things? We are going to talk about the nitty-gritty of AI in the IVF lab next. But at least from these four things, what do you think is your greatest use of AI?
I think the biggest advantage of a COVID happening in the world is that people have stopped traveling. What a meeting used to take 1.5 days is now taking 1 hour. What people used to, productively do one meeting in a day or 1.5 days, people are able to do 5 to 6 meetings in a single day. So I think the video conferencing has really aided the corporates or the entrepreneurs or the doctors or even the patients to a great extent. And I think going forward, this is going to be the way to talk to people and to communicate. Of course, personal meeting for the first time is definitely much different compared to doing these virtual meetings. But, that is one transformation that I see. The second thing is, as ma'am was talking about the WhatsApp thing, I think, how things have really become so easy for us that, even like if you want to ask a bank balance earlier, you might have to call few people and then they will ask your account number and then you will do that. But now with the help of WhatsApp chatbots, you can just type in and you can easily get a balance from a bank account. Sure. So that has really helped. From a patient-centric point of view, I think a lot of times patients struggle to call the centers and get information, and there are a lot of time when the phone is not picked up and they are not able to get the information, which with the help of WhatsApp chatbots as well as the chatbots which exist on the Facebook as well as on the website, they are able to get the basic information which they need to visit the center. So I think it has aided, in all arenas.
Sure. Thank you, Nitish. Nikita, what about you?
Electronic reporting, it really helps, because like I said, all the 17, 18 centers are connected. So, we know what's happening. Somebody has a problem there. We just are always early morning, we drop in, we know what's happening in every center. Anybody had an issue there. So I think we would never have that, One is in Varanasi, one is in Bombay, one is sitting in Calcutta. So I think that has really helped us out. Even with the drugs, I feel the embryos, we all can sit together and decide, I think you should put this, why not, everything with injections, or suddenly somebody forgot the injection, the doctor wants to ask. So I think it is important. Secondly, even WhatsApp, now if you're in the OT for 2 hours, you do not check your WhatsApp, you see so many patients asking, are you going to come to the hospital? Are you going to reach there? So I think we cannot be out of the AI. You need to be connected always. Maybe it's so bad, but you have to.
Absolutely. Keshav, what about you?
I think what is going to happen with automation and AI is that, especially like Nitesh was mentioning, that you'll have these chatbots which will come up. So taking medical history, analyzing medical history, especially the first, like before the first visit, can actually really change in the way that a patient is handled when he walks into the clinic and sits in front of you. Because like all of us are sitting here, we would want to see as many patients, and like especially in our field, each patient can take anywhere between 5 minutes to 1.5 2 hours for the first consultation. You don't know, but once you have that data in, once you already analyze or pre-analyze that data, it really changes the way that you handle the patient, especially in the first visit. Electronic records, analyzing data from electronic records is going to completely change. I've also used AI in the laboratory, and I think it brings so much standardization amongst practice, amongst like a team of embryologists. So that's again something that I'm looking for. Consistency is something that I'm looking for. And these are ways in which AI is going to actually contribute to our field.
Absolutely. Thank you, Keshav. I'm going to move to some specific examples of how AI can now help in IVF. We've broadly covered what is AI. We've covered the fact that AI has actually permeated our lives and IVF practice already. And we have established quite well that AI is already here. Perhaps not in the form which James Cameron and Arnold Schwarzenegger thought of, but it is there. I'm going to ask Dr. Asha Bakshi first. It has been well documented that using that automated antral follicle count with a 3D ultrasound machine is probably one of the earliest clinical uses of AI, particularly with these advanced ultrasound machines. What is your opinion on that? Useful, not useful, a need for something better or little better technology? So, Asha?
I think that's a good question. And these ultrasound machines, the GE machines, they have that device where you can really get the volume of each follicle. And I have had it since last 10, 15 years, but I tell you, I have never used it. So somehow I find it more time consuming, and I'm much better with my one
eyeballing
across eyeballing. So that is there. But I think, yes, with time, these things, maybe it will get a little bit simpler than what it is at the moment, and then it will help, and that will help us actually structurally telling us about the flow of the follicle and how this follicle is going to be and what sort of crop it is going to give and what sort of injections, because it will have lots of data. So maybe what sort of dose of the injections we should be giving. I just want one thing, and one thing is that there should be some formula that to this patient you give this much injections and you will get 7 good eggs. That's it. If I get some so maybe in future we'll get some help from all these things, and it will be. But clinically till now, I never found it very useful, and I hardly ever use it. We have it, but I hardly ever use it.
Keshav, sure. But just give me a minute to
I'll keep it very short. I think what this does is it gives you like standardized information, and then only, I mean, when we are looking for building something like Asha ma'am is saying that you have which we already have, where you can do dose predictions, but unless and until you feed standardized information, you won't be able to actually get standardized results. And that's where all of these fancy gadgets come into play, that at least you're feeding in the right information.
So I'll move on to Nikita now for the next clinical question. And I'm going to segue from what Dr. Asha Bakshi said about predictors. There are a lot of scores with a whole lot of parameters. And as Keshav said, standardizing the data is really important. In your experience, is there any kind of artificial intelligence algorithm? And I'm bringing in that word artificial intelligence deliberately to make sure that everybody remembers that's what the panel is on, where you could put in a certain amount of data and say, you have this patient where you're not sure whether you should do an IVF or whether you should do some other kind of treatment or even leave her alone. And do you think that artificial intelligence could help you to make such decisions? And if you think that they could, then what would be your expectation from such an algorithm? Because at the end of the day, this is an algorithm. where you put in a certain set of data and the algorithm will give you what, the decision. So Nikita, any experience with any of these kind of predictors?
Like now we are doing the tailor-made approach, what patient comes with the BMI. But when we have our students, we have a lot of 6-7 students coming in. So we made an algorithm for them. So that if we are not around, we have to know what's their BMI, age, what was the indication, what was the sperm count. And then with that, we have made an algorithm saying this is the dosage we need to give her for the first 5 days. After that, maybe on the day 6, she comes in. And if we need to increase the dose, decrease the dose, we have made an approach, but I would still say we need to come into the picture in middle. Not always we go according to the algorithm completely. So
Sure.
We might have, if the algorithm says make it 375 dose, but I feel no, fine, it looks good, I wouldn't change it and I go with 300, the same dosage. So yes, maybe it will help the juniors who are just coming in and trying to learn, so they get the confidence with that. But I think for us it will be very tough to go with this because we want to use our mind. Even if they say we are going to say I'm going to do this, it's really going to be tough for us.
Sure. But I'm sure that even when we have better algorithms, we still will be able to use our minds because ultimately the clinical decisions will remain with us. Nitish, what is your experience with computer-assisted semen analysis? After all, if I remember right, that was actually one of the first uses of artificial intelligence in andrology and by extrapolation in fertility.
Yeah, so I look at CASA from the way of first thing is standardization because new people coming in the system, there is always a learning curve. It reduces that learning curve. But in terms of reducing the time it takes for embryologists to actually do a semen analysis, it doesn't aid that much. People take manually the same time compared to using a CASA, but it definitely gives us more information, more standardization, and more reliability in terms of the data that it offers.
Thank you, Nitish. I think you will also agree that when you use a CASA, there is a certain amount of standardization to what is relatively a subjective analysis, which is the semen analysis. Where it might become easier to compare the results across labs because 30% morphology being normal could easily be 35, 40, or even 50% in the hands of another person studying that slide. Keshav, literally the $1 million question here, embryoscopes. And, embryoscopes perhaps have been looked upon little, if I may say so, with a little cynicism so far. But perhaps people don't understand that the reason why embryoscopes have not been the absolutely wonderful breakthrough that they should have been is perhaps because of the software. And, we are looking at new softwares like Life Whisperer, etc., which will probably make embryoscopes, and I'm hesitating to say this because there are two embryologists here, but embryologists of the future. So Keshav, what are your thoughts on that?
I am an embryologist. I'm very in for AI coming in and replacing my thoughts because I've had experience, like you mentioned, Life Whisper. We did a pilot for Life Whisper way back in 20 for India. And within that set of patients, it was only a set of 20 patients. I could actually make out the majority difference that it was creating because between the 4 embryologists that I have in my laboratory, each of us grade an embryo differently. Even if we are at the same level, even if we are at the same experience, we will have our personal biases. We will feel that, okay, this embryo is looking really good for me. I have a gut feeling that this embryo might result in a pregnancy, but that doesn't work. We now have to really move on towards more standardized approaches towards selecting embryos. And that is where AI definitely comes into picture. Now, what AI is doing is that it's dividing the embryo into different segments. It takes out the trophectoderm, it takes out the inner cell mass, it takes out the cavity, the zona, etc. Analyzes each component separately, and then comes up with a scoring or a grading or a basically prioritization score that this embryo might result in a faster pregnancy, etc. And that is something which I think as embryologists, even as experienced embryologists, we will have our good days, we will have our bad days. But with AI, it's always good days. And like you said, embryoscope is basically a little different from AI because in the sense that embryoscope is basically looking at morphokinetics. But there also you have algorithms, there also you have artificial intelligence trying to improvise and improve upon that software itself. And like most of the Western world is now shifting towards it. If the cost was not there, it would have really come into India at a very larger scale as well. But because of the cost implications, I think we're struggling a little bit.
I fully agree with you. I mean, it seemed like such a promising technology. You're not removing the embryos, exposure time is less. You're literally monitoring embryos so many more time than you otherwise would. And therefore, it should have actually made a material difference. And perhaps we need to look at the software and AI to make that difference. Let me move on to the next part. We really don't have much time left. We just have around 10 minutes left, but I must ask everyone this. What is your preferred way of retrieving information from the internet? They say that the internet is great because it takes only 2.5 hours of wasting time on the internet to do what I would have otherwise taken 5 minutes to do. Because, once you start searching, then you'll end up searching so many more things, besides what you are actually searching for. So, Dr. Asha Bakshi, when you're preparing a talk, what is your favorite way of getting information from the internet?
I retrieve those articles which are most interesting and most appropriate, and still I print them, and then at leisure I read them, and so I'm a little bit, I'm not as good as you people, but yes, I do read the topic, whichever is very important, I'll print it out and then again go through it and then prepare my talk. So
sure. PubMed is your central repository for information. What about you, Nikita?
I PubMed, Safari, go on, all whichever, like you said, instead of 5 minutes, I go on 2 hours seeing other places. Yeah. So I don't stick to one.
Absolutely. Nitish?
I think I'll probably go to everything. I'll also go to YouTube, see what other people have given the lectures earlier, what they have covered.
That's a smart.
So the world has really gone, smaller, and the information is there. I mean, you should go and, utilize it.
Sure. Thank you. Keshav, what about you?
100% the same as Nitish. I go to YouTube, I listen to a few talks which have been given on similar topics. Then I go to the society websites as well, especially like HPA, SRM. Look out for guidelines which have been published. Go through those, go through their campus courses. I waste a lot of time preparing a single talk, but I mean, that's pretty much it. That's the general route that we take.
Sure. But I think it's always a good idea to, in your mind, have a structured way of getting information. And so your structured way could be YouTube talks first, followed by guidelines. Yeah. My structured way is a PubMed search first, followed by retrieving articles and then looking at those articles in particular, and then using them as a springboard. I generally tend to read guidelines last. Because I think they cloud my thinking. And I only then rely on the guidelines rather than looking at the individual pieces of evidence which make up the guidelines. And I think it's the individual pieces also which are quite important. Let me now go on to the last two questions of the panel in the last 7 minutes that we have. I have always felt that artificial intelligence could make a world of difference to access, particularly for things like infertility. There is this scene which is always there in, Bollywood movies or, in movies across a lot of languages where this person goes to buy a condom. And then it becomes a bit of a comic situation where he's embarrassed. He doesn't want to ask for a condom. I understand it's at cross purposes with infertility, but it's just an example to talk about taboos. And we know that infertility is, in fact, a fairly large taboo. How do you think digital technology could enhance access? I'm going to ask this to Nitish first, and then we'll follow that with Dr. Asha Bakshi, Keshav, and Nikita. Nitish, the use of technology to enhance access for infertility, and I'm here talking about access for patients.
I think internet has really aided a lot to this world, not in infertility, but to all fields. And now patient has an easy access to, of course, it confuses the patient also because there is so much amount of information, right and wrong. They really don't understand what is right and wrong. But just to satisfy their queries to satisfy to their questions regarding basic information. They're able to get it from the internet. But of course, once they go and meet the doctor, they are more educated in terms of what they really are suffering from and what are they wanting the type of treatment. So for a doctor also to feed in that information or correct the patient in terms of treatment, it becomes slightly easier.
Sure. So
that he's more informed.
I'm sure that we can use technology to enhance access. Dr. Asha Bakshi, what about you?
Yeah, I think what happens is patient searches the whole thing, and then he first of all tries to cure his disease himself, his problem himself, and that's where the biggest problem is. And then he gets ultimately disappointed, and then he searches for the doctor, and then he goes through all the reviews and everything. But at the last, what works is the neighbors and the relatives and all. They will tell that go to this doctor. Then again he will search, is this doctor good? And then he will come to you. And whenever the patient is not listening to you, that is another thing I say, go and check it on internet, Google it and find out about your problem. So that whenever too many questions, I ask them to again go and check on Google. But I think it has made a lot of difference. They are understanding their problem and they are coming in time. I remember those days when we started practicing infertility and patients used to come so late when everything, they were exhausted, age and all. There were no eggs and they were coming. Nowadays, they are so smart. Even they have tried for 6 months and 1 or 2 cycles of IUI, and they know. You say that let's try 1 cycle of IUI, they will say no, I want IVF. IVF has got much better results than IUI. So I think internet is educating them, and it's a very good way of getting information, especially those who can understand properly.
Thank you. I think that's important because access, not only in terms of actual access, but also leveraging the access is what you're saying. So Keshav, what about you?
Yeah, so I completely agree with what Asha ma'am was saying at the end of it, because we're actually increasing the amount of awareness and that ultimately increases the access. There are so many apps that are now available, which patients have access to, which predict like ovulation, which predict like chances of STIs. I mean, all of these things are ultimately going to help our patients and benefit them. There are also easier ways now to order medicines online. I mean, those things are also available. Like coming to a diagnosis, WebMD is something which has been there for so long. I mean, that's something which predicts. You put in your symptoms, you get a list of things that could happen. Obviously, cancer is always there on that list, and it freaks you. But it does bring in that certain amount of awareness that okay, there might be something which requires medical attention, and you might go and visit a doctor earlier as you might not delay visiting a doctor. I think that's something that's coming up quite a bit. And ultimately, once you're standardizing the whole procedure, once you're offering better results, I have a feeling that with AI coming in, with technology coming into the picture, early on it might be expensive, but later on it might reduce the costs as well, which ultimately would increase access to our patients.
Absolutely. And I think technology is something which evolves with time. I remember the first computer I bought had 10 megabytes of memory. And, we were also excited that we got the latest computer with such a large amount of memory, 10 megabytes. Just imagine 10 megabytes now is a typical WhatsApp forward. So things have changed so dramatically with technology. As Bill Gates actually said, we always overestimate the change that will occur in the next 2 years. And we always underestimate the change that will occur in the next 10 years. And I think that's a nice note to complete my panel. Thank you very much, all of you, Asha, Nikita, Nitish, and Keshav. I'm sorry Sunita could not be there for some part of the panel. I believe she had an emergency which she had to handle, but then this is really where artificial intelligence can't help, because we can't always predict when the next emergency will come. Thank you very much again to the team from ET Health World. And it was quite a pleasure and privilege conducting this panel with such eminent panelists. Thank you.
Thank you everyone for such an engrossing and interesting discussion. Now time for another break. Stay tuned.